Hello, welcome to Doctor Talks. Here we chat with best doctors about diseases and conditions they treat. Our guest today is Dr. Mukesh Laddha. Dr. Mukesh is one of the top orthopedic specialists in India. He heads the Center Robotic Joint Replacement and Sports Medicine in Nagpur. Dr. Mukesh is pioneering the use of robotic technology in joint replacement. Welcome, Dr. Mukesh.
Hello Vivek, thank you for inviting me. I'm highly obliged.
To start with, I would request you to share your background in medicine with us.
Hi, myself Dr. Mukesh Laddha, shoulder, knee and hip surgeon, robotic joint replacement, arthroscopy and sports medicine specialist, practicing in Nagpur city, which is centrally located in India. After my basic education in orthopedic training, I trained myself at various centers in India and abroad in the field of arthroscopy and joint replacement. In India, I got trained myself in Mumbai, Kochi, Coimbatore, and abroad I went to Seoul, Japan, UK, and London to train myself in the field of arthroscopy, sports medicine, and joint replacement surgeries. Since last 10 years, I am into private practice in Nagpur, treating shoulder and knee joint pathologies related to sports injuries, ligament injuries, rotator cuff injuries, and replacements of shoulder, knee, and hip joint. I am the only surgeon in central India doing robotic assisted total and partial knee replacement surgeries.
Thank you, doctor. Today, I wanted to discuss about knee replacement surgery with you. But before that, I would like to share few interesting facts with our listeners. Knee replacement surgery was first performed in 1968. Since then, improvements in surgical materials and techniques have greatly increased its effectiveness. According to the Agency for Healthcare Research and Quality, more than 6 lakhs knee replacements are performed each year in the United States, while as per some estimates, India will see nearly 1 million knee replacements every year by 2022. Coming back to our discussion, can you please explain what is knee arthritis and its types?
Basically, there are two types of knee arthritis which is commonly observed. The first is an age related called as primary osteoarthritis, which everyone will have in the world in some form or the other. As the age increases, the cartilage of the joints shows wear and tear. So each and every joint of the body will be affected, but knee joint is most commonly affected because it's the weight bearing joint. So this is called as primary osteoarthritis. There is another form of arthritis which is quite common worldwide, is called as rheumatoid arthritis. This is an inflammatory form of arthritis which can develop in early age called as juvenile rheumatoid arthritis, or sometimes it occurs in elderly population also. In this, it affects mainly the small joints of the hand, the wrist joint, hip as well as the knee joint. And another 2 to 3%, there are another form of osteoarthritis secondary to other inflammatory problems. So the most common are two forms, primary osteoarthritis and secondary to rheumatoid arthritis.
Who is commonly affected by knee arthritis?
As I mentioned in my previous answer, primary osteoarthritis usually occurs in elderly patient, female usually after menopause above 45-55 years, and male usually after 65 to 70 years are affected with primary osteoarthritis. If a patient is suffering from rheumatoid arthritis, then they may be as young as 20-21 years also.
So, doctor, you're saying a patient as young as 20-21 years can get knee arthritis, right?
Yeah, but provided they have inflammatory form of arthritis called as rheumatoid arthritis.
And what's the trigger for that kind of arthritis? Is because of a genetics or it's because of some lifestyle?
No, mainly rheumatoid arthritis is genetically motivated, but there are multiple reasons for primary osteoarthritis. In primary osteoarthritis, age is the one of the biggest factor. Second, your eating habits leading to obesity in current era, obesity is one of the other major factor which put excessive weight on your knee joint, thereby causing its wear and tear early in the age.
What are the treatment options for knee arthritis? Can you describe both medicine based or non surgical and surgical options for treatment?
So let me divide it into two as we have divided the type of osteoarthritis. So first I'll discuss the most common form, that is primary osteoarthritis, which usually occurs in older population above 50-55 years. So no one can run away from this osteoarthritis. But if you take care of your body well from your younger age when you are in youth, do a regular exercises, keep your body weight within control limits, have good eating habits, try to avoid junk foods so that your overall body mechanism is quite better. Most importantly, I would like to focus here the importance of exercise and physiotherapy. Though it may not prevent you from developing osteoarthritis, but if your muscles are quite flexible, the excess weight on the joint is little bit less, so it delays in the onset of osteoarthritis. And your exercise schedule should be quite perfect, at least 5 times a week, so that your bones are healthy enough, the nutrition to the joint is healthy enough, and your proper eating habits will keep you overall as well as your joints healthy. So these are some of the non-medical measurements in form of physiotherapy and exercise. Once you start having pain because of this osteoarthritis, then you need to consult your doctor, which may give you some regenerative medicines in the early stage of osteoarthritis, which are basically chondroitin sulfate, which helps to regenerate the cartilage at the molecular level. But they are helpful only if you diagnose it in very early stages. So some nutraceuticals are very helpful. Painkillers are usually taken only when it affects you a lot. Then the third option is there are some intra-articular injections which helps you to increase the lubrication of your knee joint. That has to be taken after consulting with your primary doctor. So these are the medical and the non-medical treatments in form of physiotherapy. Once you have utilized all these options of non-surgical management and you have reached a stage where you feel now the knee joint is hurting you a lot, it's affecting your activities of daily living, you are unable to drive your car, you are unable to walk for more than 500 meters, you are unable to go and enjoy parties with your friends or other social activities, then that is the stage you have reached a grade 4 or severe form of osteoarthritis, and you need to consult your doctor for knee replacement surgery. And the second thing about rheumatoid arthritis. Rheumatoid arthritis is altogether different treatment. Most of the time and very long duration, you have to take disease modifying drugs under the care of proper orthopedic surgeon or a rheumatology surgeon.
How do you diagnose that this patient has to go for a knee replacement surgery?
Yeah, that's a good one. Uh, as for example, a patient around 60-year female coming to my outpatient clinic complaining of pain in her knee joint since long duration, and she is exhausted with all the non-surgical treatment. So the way she enters in my OP clinic, this patient usually have a waddling gait because the knee becomes deformed and round, called as varus deformity. So that's the one sign which tells me that she needs knee replacement surgery. Then we clinically examine the patient to see that she don't have any problem in the hip joint or in the spine or in the ankle joint. We then check the amount of deformity she is having, the muscle power, the sensations, and the deformity correction possible or not. After doing her thorough clinical examination, we send them to do a proper X-ray in the form of standing scanogram, single leg AP standing, lateral views X-rays as well as skyline view. If the X-ray shows that it's a grade 4 or tricompartmental osteoarthritis, then that patient needs total knee replacement surgery. So once we diagnose that she is now a candidate for total knee replacement, We explain the patient in detail about the procedure, how it is done, and then you have to do some basic pre-operative blood test in the form of complete blood count, liver function test, kidney function test, coagulation profile. If patient is diabetic, then you have to see the sugar status, thyroid status, urine examination, as well as being a very major surgery. We go for cardiac fitness also in form of ECG and 2D echo.
What would a patient expect during the procedure and after the procedure is completed?
The procedure goes this way. Once we get the complete fitness of the patient from a physician, because most of the old patient have some medical issues like diabetes, some patient have cardiac issues, some people have a thyroid problem. So once we get the proper fitness from a physician, controlling their blood pressure, sugar and all, we then ask the patient to get admit a day before the procedure or a day or the same day in the morning. We ask them to be empty stomach for about 6 hours prior to surgery, and our anesthetist meet them and explain them the procedure of anesthesia, which is usually a spinal if it's a single leg operation, or if we are doing both the knee replacement in one sitting, then it's an combined anesthesia in form of epidural as well as spinal anesthesia. And once patient is explained about this, we take them to operation theater, we prepare and scrub, we do the procedure. I usually do now all my knee replacement with the help of robotics assisted, and once it takes hardly 60 to 70 minutes for the whole procedure. Once surgery is done, patients are shifted to the recovery room where they take a rest for a while, and then to their respective room. And as soon as their anesthesia goes off, we start the physiotherapy 4 hours after the surgery in the form of knee bending, active leg raising, ankle pumps, and if patient is quite comfortable, we make them stand and walk the same evening or the next day morning.
Doctor, you mentioned about the robotic surgery. Can you share more about that? How your center leverages robotic surgery during knee replacement?
If you see, the knee replacement surgery started way back in, I think, in around 1965 or 70, and from that time significant development have been done to improve the outcome of the surgery. This knee replacement surgery, basically what we do in that, we remove about say 8 to 10 millimeter of the part of the bone, leg bone called as tibia, and the thigh bone called as femur, and we replace it with a metal implant and a plastic implant between the two metals. Now each individual, every individual have the same knee joint, which is formed by three bones: femur, thigh bone, tibia, leg bone, and the kneecap called as patella. But there are some definite angle difference, which is very specific to each individual. Though the knee joint is formed by same bone, but there are angle variations. So conventional knee replacement, which has been done since long, had shown about excellent result in 80% of population worldwide, and it is the statistic analysis all over the world that still around 20% of the patients who are undergoing total knee replacement were not happy. So there were two factors: one related to the procedure, second related to the patient. So one which is related to the patient should be that we should give them realistic expectations that out of the whole body we are replacing only one joint, that is knee joint, which won't make them younger but definitely will give them a significant amount of pain relief, good mobility and function. But they don't expect that they should run and do other sorts of things. So the expectation to the patient should be very realistic. Secondly, as I told you, each individual has a specific angle which may be 1 degree varus, 2 degree varus, 1 degree rotation, half a degree flexion. So all these specific angles is not possible for the naked eye to calculate. So to this, my robotic helps me in precise planning of each and in every individual knee replacement. So it is a customized knee replacement surgery. So it helps me to make a precise cut in the patient's bone, which is quite normal or near normal to his body. So the knee replacement implant position is quite perfect. Secondly, knee replacement success depends on the ligaments, two main ligaments called as medial collateral ligament and lateral collateral ligament. So in conventional, we don't have any objective measurement to know how much the ligament we have to release and how much tight we have to keep it. And robotic gives me an objective numbers of how much I have to release so that that is specific for that patient. So in short, I'll tell you in a lay language, if you go, suppose you have a size of your shirt say 42 or 41 to be more precise. If your shirt size is 41 and if you go to a ready-made garment shop, they will give you a size of 40, 42 and 44, but they won't give you 41. So it's only a tailor who can make a precise size of 41 for you, which will exactly fit you. The same way, my robotic helps me to exactly plan what is the ideal position of the knee implants for my patient and the amount of ligament balance. That's the beauty of robotics.
The shirt analogy was a really great analogy, doctor. And can you share what difference you would have observed in the expectations or the results of your patient when you had treated them without using robotic technology and now when you are treating them with robotic technology?
Yeah, I have definitely seen a significant difference in my own patient's outcome in the form of earlier they used to complain of pain after surgery for 7 to 8 days. Now they complain of pain only for a day or two. So the amount of painkillers have gone down drastically. They feel quite confident in getting out of the bed within 24 hours of the surgery because they feel that there is a natural knee in spite of an artificial knee because the robotic precision and quiet ligament balance. They have almost full range of movement which they didn't have before surgery. They are going home even after both knee replacement, walking without any support on third day of surgery. The stair climbing is done within 48 hours of the surgery, which patients are doing on their own. So the confidence level have grown up very fast and they feel like they have delayed the surgery because of the other parameters they have to decide for surgeries. So overall, if I say the blood loss have reduced significantly, the precision of surgery has improved, surgical time has reduced, patient's confidence has gained, bone loss is minimum, ligament balance is very precise, patient don't need any extra physiotherapy in about 70% of the patients after robotic assisted knee replacement. They are fast to their activities of daily living within 7 to 8 days of surgeries, and their activities of daily living like going outside and socializing within 3 weeks of surgery. And without assistance, they are able to walk within 48 hours of surgery.
Great, and those are very wonderful results. Just for the information of our listeners, are there any associated risks with knee replacement surgery?
Yeah, knee replacement surgery, if you go, there are a number of risk factors. And as I told you, these patients are elderly patients, most of whom have some or the other form of medical problems. So the common complications is what we find is DVT, that is deep vein thrombosis. So to prevent them, we start mobilizing the patient within 4 hours of the surgery. And if patient is high risk for that, we start some blood thinning agents immediately after surgery. Secondly, there are chances of infection which is around 1% worldwide. There are some high risk patients like one who is on diabetes, patients who are immunocompromised, patients who already have previous surgeries on their knee, they are high risk. So we have to take extra precaution in preventing them. That is, that sugar should be strictly controlled with our physician in house, and rest of the things, as I told you, we mobilize them fast and we take care with the help of antibiotics. Old age patients usually are osteoporotic, so chances of fractures are also there. These are all short terms or early. In delayed complications, you may see implant loosening. That is the failure of the prosthesis if you don't match the alignment and balancing of the knee. So with robotics, the alignment and balancing is quite perfect. So the knee replace procedure may last more than 15 to 20 years. Another minor complications of some allergy, some swelling on the foot, some stiffness post-operative, which is there, which is taken care very well with physiotherapy and other measurements.
I was reading an article about knee replacement and it stated that success rate for knee replacement is higher than 95%, while majority of artificial knees implanted continue to be in working mode even after 15 years. Is this correct, doctor?
Totally correct. Agreed. As I told you, the success rate is more than 98%, but the satisfaction rate was around 80% because of the various issues with the patient satisfaction and the component placement and ligament balance. So, to improve the satisfaction rate of the patient, conventional was replaced by computer navigation surgery, and above computer navigation, now we have a robotic assisted knee replacement surgery. And if you follow and you see the results, even the 15-year success was there with the conventional surgery. So to improve that 15 years, we have come out with robotics so that we are aiming patient needs only one surgery of knee replacement in his lifetime. If suppose patient comes to me around 60-65 years of age, and if I can give him a knee replacement for up to 25 years, that means till he becomes 90, so he can have only one surgery in life.
I understand you undertake various activities to support weaker sections of society. Can you please elaborate your efforts to support patients?
Various activities which we take to support the patient. First, we have patient education program through our various website, our YouTube channel, where we have been educating them about how to delay knee replacement surgery, so that the later they come to us, they need one. If suppose someone comes to me at 50, 55, they are high demand patient, they have lot amount of activity. So even if whatever good job I do, it won't last more than 15, 20 years because they are quite active patient. And the same patient, if it comes to me at the age of 65, 70, their activity levels are less. So the success will last longer. So we try and encourage and help educate our patient on how to delay it. Secondly, if someone needs knee replacement surgery in spite of all this and they are quite weaker financially, then we as a hospital take a combined decision of doing it at no profit, no loss basis for a monthly 4 to 5 surgeries. So we categorize them. Our department, there are some people who are working with me, they take care of their other things, categorize them and give them concession whenever they need. And we have some other some NGOs who helps us also in treating the weaker sections.
That's a really nice initiative from your side, Dr. Mukesh. And today your inputs helped us understand about knee arthritis and both surgical and non-surgical treatment approaches to it. We also learned about knee replacement surgery by leveraging robotic technology and its benefits. Thank you for talking to us.
It was indeed a pleasure for me to have invited by you on Doctor's Talk. Thanks a lot.
Dear listeners, please share and spread awareness about knee arthritis and its treatment by sharing this podcast. Cheers. Till we meet next time.